Good morning, students. Today we will see about the endocrine system. The endocrine system is a very important system. Most of the time, BSc, paramedical, GNM students, some of the hormones and functions been asked. So in this class, we will detailedly see about what is endocrine system, how this hormones been secreted, and what is the function of it. You see, if our human body need to function, we need a fuel, right? If you think it's the food is our fuel, you need the hormones and enzymes. It's work like engine oil. So if the engine is good, we can live long, correct? So endocrine system is also like looks like it's a partly will be autonomic nervous system and partly will be a endocrine system because it is maintaining the hemostasis of the body, that is internal and external milieu, the environment being maintained in our body. So the endocrine system mainly consists of glands. The glands are widely spread throughout our body. So the endocrine glands are secreting some substances which is called the hormone. The hormones are called the chemical messengers. You should understand what is the hormone. These hormones are directly poured into the blood, and from the blood it is going and exactly achieve the target cells. So the target cells are secreting this one hormones. Means why I am telling again hormone, because the pituitary and hypothalamus act as a one unit. In this chapter we will see this pituitary and hypothalamus mainly acting as a one unit, and hypothalamus activity will be changed due to your mood and other things. The what is hypothalamus? Where it is presented? So hypothalamus, it is in the hypophyseal fossa of the sphenoid bone. It is below the hypothalamus. The pituitary is situated. So the pituitary is like a small pea in size. Hypothalamus maybe it is in your nail size. It is nearly 4 gram only it is weight. Master gland, it will control this one. So in this chapter we will see what are all the hormones mainly secreted by the hypothalamus. You have to remember the hypothalamus mainly secreting the like a growth hormone or inhibiting hormone. That means releasing hormone and inhibiting hormone. Releasing and inhibiting, he is the master, is a director, is a deductor, we can tell anything that. So it will feel where there is a then it will tell the other glands to. So when it is releasing hormone, it will react with the pituitary will react. If you say the pituitary, there is a two kind of the pituitary, anterior pituitary and posterior pituitary. So anterior pituitary, mostly what all the hormones are secreted we will see, and the posterior pituitary only two hormones, oxytocin, ADH, only two hormones are secreted. The cells in the anterior pituitary is different from the cells in the posterior pituitary. The posterior pituitary mainly neuronal cells are present. Okay, let us see what is the hormones secreted from the hypothalamus. So you hope you understand endocrine system is a very important one system. It looks like engine oil. The small amount of the hormones are secreted from the ductless glands which is present throughout the body. In this chapter we will overall see what is that, what all the glands are secreted and what it is been secreted. Mainly before going into the depth of the system, how these hormones being regulated. It's like a regulatory mechanism, mainly by the positive and negative feedback mechanism. How the feedback mechanism will be working? Because it's working because of the hypothalamus and pituitary act as a one unit, ecta unit, one unit. So hypothalamus is the master gland. Where it is present, it's a hypophyseal fossa and the sphenoid bone. Below the hypothalamus, pituitary is situated. Pituitary is a two type, like anterior pituitary and posterior pituitary. Anterior pituitary secretes some hormones we will see, and posterior pituitary some cells or neuronal cells are present. So posterior pituitary always you have to remember oxytocin and ADH. ADH other name is called vasopressin. Okay, now we will see first is a like a hypothalamus. Hypothalamus, you have to remember the concept that always it will be secreting the releasing hormone and inhibiting hormone. in a form we have written like GHRH, growth hormone releasing hormone, CRH, corticotrophin releasing hormone, and then gonadotropic releasing hormone, prolactin releasing hormone. And if you see inhibitory hormone, growth hormone, inhibiting hormone, prolactin inhibiting factor. Okay. So when it will be acting, hypothalamus will be feeling in the blood, because the hormones are secreted, poured directly into the blood. So it will feel there is a growth hormone, the growth is less, or this what is happening. When it is feel it, it will release this hormone. Then I told you anterior pituitary, it will act as this one. For example, thyroid is very less. The hypothalamus felt it, then it will be developing a positive feedback mechanism. When it is less, it will stimulate the TSH. So TSH will be secreted from the anterior pituitary. Then when the anterior pituitary secreting TSH hormone, the TSH hormone directly poured into the blood and directly going and hitting the thyroid gland. So thyroid will be thyroxine hormone will be secreted, T3, T4. When the thyroid level is increased in the blood, hypothalamus will feel, then it will be inhibiting hormone will secrete it. So it will stop secreting the TSH. Understand? So this is the concept you have to understand. So this mainly we are discussing about how this mechanism is working as an endocrine system. Okay. Next you see this pituitary gland. So adrenocorticotropic hormone, FSH, follicular stimulating hormone, luteinizing hormone, growth hormone, all these are mainly secreted from the anterior pituitary. Only two hormones which is secreted in a posterior pituitary in the neuronal cells, oxytocin and vasopressin. Okay, the oxytocin, if you see, mainly it is like milk let down mechanism. When the breastfeeding, the child is breastfeeding, the cells in the breast cells activated, the impulses will go to the spinal cord. Then the spinal cord, it is called to the hypothalamus. From the hypothalamus, it is it is stimulated. From this, oxytocin is released. When the oxytocin is released, milk is coming out. So that is about this. Only milk it is playing main role? No, it is also playing a main role in a uterine contraction. So when the baby uterus is full, about a full term mother, there is a pain, and immediately the same way it is activated, then the contraction will be beginning and the baby will be pushed out. And then what about ADH? Is called vasopressin. When there is a osmotic level is less, when the hypothalamus feel in the blood, so what it will act upon a kidney. So vasopressin act adrenocorticotropic hormone, AC. So these hormones will be releasing it, and then kidney glomerular system will be activated. They will start to reabsorb. Okay, reabsorb, and so that osmotic system will be back and hypothalamus will be back. So this one, this is the one. So in detail we will see that this is the overall concept I am explaining. So we have seen about the hypothalamus, where it is presented, what hormones. Mainly you have to remember about releasing hormone, inhibiting hormone. Then according to that, hypothalamus and pituitary acting as a one unit. And pituitary is the two kinds of the anterior pituitary and posterior pituitary. Posterior oxytocin and ADH hormone. Okay, next is the thyroid, the front of the neck under the skin. There is a leaf like a butterfly like a structure which is present, which is a thyroid gland. If it is coming as the anatomy about the thyroid gland, you have to write about the like a structure of thyroid gland, where it is present, and what is the arterial supply of the thyroid gland. Understand? What are all the arteries or which is supplying to the thyroid gland, you have to write, and what is the venous supply, what is the position, how many lobes are present, you have to write. Understand? Then what is the size of the gland and how much amount of the hormone being secreted, you have to write. Then in this T3, T4, what is calcitonin? In the thyroid gland itself, C cells are really secreting the hormone is called calcitonin. This calcitonin main function is osteoclast and the bone formation and other. Only this hormone is enough? No. It is also by the help of parathyroid gland, which is secreting parathormone. So this also playing a main role, like the negative positive feedback mechanism. Hypothalamus will be activated upon it. Then will be both the hormones playing a main role in the formation of calcification of the bones. It is very important. And thymus gland secreting hormone thymosin. Okay. Then another one like a pancreas. This is the pancreas where it is presented. Is like a structure, This is a head, neck, body. These are all will be there. This pancreas, there are 3 kinds of the cells are present: alpha cells, beta cells, and gamma cells. So alpha cells are secreting glucagon, beta cells are secreting insulin. So glucagon will be increase the blood glucose level, insulin will be acting upon decrease the blood glucose level. How it is decreasing? When there is a insulin is secreted, it will be entering into the blood and it will go inside the cell, and then if the insulin is present in the cell only, glucose will be absorbed from the blood. Otherwise, what will happen? There will be stagnation of the glucose in the blood. So what will the kidney will do? What will the hypothalamus will do? That is what. So when there is a high level of insulin present, and immediately it will secrete through the urine, blood glucose level will be increasing, but the cells will be deprived. This is called type 1 diabetes mellitus. Sometimes the insulin will be good in amount, but the cell is very defective. They cannot take up the insulin to absorb the glucose. So that is called type 2 diabetes mellitus. And gamma cells, somatostatin, that is the GHRH, growth hormone releasing and inhibiting hormone, mainly pancreas. These 3 cells are mainly secreting. The another important one in the both the kidney, there is a gland which is present, suprarenal gland. It's otherwise called, it's called the adrenal gland. The adrenal gland, if you cut into this is a cortex and the medulla. So the cortex mainly you can remember 3 hormones, that is the glucocorticoid, mineralocorticoid, gonadotropin hormone, sex hormone. Glucocorticoid, mineralocorticoid, gonadotropin hormone. Medulla will be by the epinephrine, nephrin and the epinephrine. So these hormones, if you see, nephrin and will be the epinephrine hormone. So how these hormones are activated? So I will show you the picture. For example, if you see, this is a stress. I told you hypothalamus will be mainly, function will be influenced by mainly by the stressors. The stress will be, I told you in the beginning of the class itself, the sympathetic, it's a like a endocrine is a part of a parasympathetic nervous system, right or not? So hypothalamus, when it is the stress, it's a sympathetic center is stimulated. When the sympathetic center is stimulated, sympathetic nerves are getting stimulated, adrenal medulla is secreting noradrenaline, adrenaline, noradrenaline. Okay, so what is happening when the adrenaline or adrenaline will be increase the heart rate, BP increase, and then the dilation of the bronchioles, increase glucose level, increase and decrease digestive activity. So this all will be either what is the sympathetic nervous system, it's decrease, or whatever it may be, it will happen, or the fight or the flight response will be happen. In other hand, what's happening? It will be releasing the cortical releasing hormone. In the anterior pituitary will be adrenocorticotropic hormone will be released. When the adrenocorticotropic hormone release, in the adrenal cortex, mineralocorticoid, glucocorticoid will be secreted. So when the mineralocorticoid secreted, salt and water retention, so increase the volume of the blood, the BP will be increased. So longer term response will be there. So glucocorticoid increase the blood glucose level, increase catabolism, and decrease inflammatory response, decrease the immune response. So this is how the hypothalamus acting upon this adrenocorticoid, mineralocorticoid of the hormone. Only these hormones are secreted, only this one? No, there are about also some of the hormones are secreted. If you take it is an intestine, gastrin is secreted from the stomach, And if you see the small intestine, CCK, that is cholecystokinase is the hormone secreted mainly, which is helpful. And also in the kidney, also the renin will be secreted. So the renin mainly playing the renin-angiotensin mechanism. So what's happening, how it is being renin-angiotensin mechanism will be when the renal blood volume is low, maybe due to any reason blood volume low, that's why renal blood volume low. So once the renal blood volume low, sodium level will be also decreased. So what will happen, the kidneys will be secreting this hormone called renin. So this renin and then will be angiotensin will converted into the angiotensin 1 and angiotensin 2. So when it is angiotensin 1 is converted into angiotensin 2, what will happen, the adrenal cortex will be secreting the hormone is called the aldosterone. So aldosterone acting upon the kidney tubules. So that kidney tubules, the glomerulus, they will be increase the absorption of the sodium and water. So increase the extinction of it will be increase the reabsorption of sodium water. So what will happen, all these things will be retained. So what will happen, in the blood sodium level started to increase, so the blood volume will be increased. When the blood pressure will be increased, then it will inhibit, negative feedback mechanism will be coming. Then what will happen, inhibition mainly by the AC, the hormone enzyme is called like AZ, angiotensin converting enzyme. Then what will happen, then vasoconstriction will be happen. Once the vasoconstriction, then will be increase of the blood pressure. Then the negative feedback mechanism will be acting upon the kidney. It will be reducing the function. So this is the renin angiotensin mechanism. You can remember by one simple flow diagram. It is also the hormone which is secreted from the kidney. Then this adipose tissues also secreting some of the hormone is called the leptin. And about the sex hormone, testosterone is secreted from the this one, ovaries are secreting estrogen, progesterone hormone being secreted. And during the placenta, during the pregnancy time, the placenta is secreting the hormone is called the HCG. What is HCG? Human chorionic gonadotropic hormone. So what it is doing, it is activate upon the ovary. During pregnancy, so it increase the level of the estrogen, progesterone level also it is being increased. So from this all called the, mainly it is functioned by the regulatory mechanism or the feedback, negative and positive feedback mechanism. It is mean. So how the questions will be asked to you, you can remember by the this one. You can remember by the main thing is hypothalamus, what it is doing. That's a releasing hormone, inhibiting hormone. Hypothalamus and pituitary acting as a one unit. And when the hypothalamus say yes, and mostly anterior pituitary mainly working upon some of the hormones like either the FSH, LH or TSH, whatever the hormone it is secreting. Then these hormones will be acting upon that particular glands in our body and they started to secreting. Growth hormone means when the growth is factor, when this the defect, there will be under the problem. So the growth dwarfism will be coming or the gigantism will be coming. So what is the features of the dwarfism? What is the, how their features will be there? So which age in the during the childhood or the adolescent age that hormone will be less, means what's happening, what are all the features of that you have to understand. Then adrenal, this one mainly by Cushing syndrome or this thing. So the questions anyway it will be asked to you, either sometimes they will ask about the functions of FSH, functions of glucocorticoid, functions of TSH they may ask. Sometimes they may ask about the Cushing syndrome, diabetes mellitus, diabetes insipidus, dwarfism, gigantism, that kind of a hormonal deficiency disorders will be asked indirectly. So that all will be the physiology. And about the functions, you can write about the structure, write the hypothalamus, where it is situated, what is the weight of the hypothalamus, what is the size of the pituitary, where it is situated, what is the blood supply, what is the venous drainage, and these are all called the anatomy part. So first you have to, before entering into the endocrine system, you please understand the concept, then it will be easy for you to study. Understand? So what is the before entering to the endocrine system, you have to learn what is the hormone, where it is secreted, what is called chemical messenger, isn't it? And the endocrine system is maintaining mainly by the hemostasis, so it is called the part of autonomic system, and all partly it is called the endocrine system. And ductless glands are secreting hormone otherwise called the chemical messenger. It is directly poured into the blood, and it is going and hitting directly into the target cells. So you have to remember, and then other main concept you have to again telling, you have to remember about hypothalamus and pituitary. They both are acting as a one unit. Anterior pituitary secreting most of the hormone, but posterior pituitary only two hormone, ADH. The other name is called vasopressin and oxytocin. This oxytocin main function let down mechanism, and another one, and during the pregnancy, during the delivery, it will be mainly when the uterine contraction, mainly playing a main role. So only these many hormones are with this. So melatonin, what is called melatonin? Pineal body which is secreting melatonin. So the melatonin main function, melatonin is secretion will be suppressed during the daylight factor. So this hormone mainly in a sleeping time, in a dark factor, it is mainly this. So people are working for the foreign company, this will be affected. So automatically metabolism and other regular cycle, other things will be affected. So melatonin is also one of the important hormone. So you can able to write short notes on thyroid gland, short notes on parathormone or parathyroid gland, where it is situated, what is the size, how much amount is secreted, and how it is acting with the C cells of thyroid gland. Like that you can write it. Understand? So pancreas, they will not ask pancreas, they may ask about the hormone, about insulin. You can very well write about the insulin is the hormone which is secreted from the pancreas, islets of islets of longer hands of beta cells are secreting insulin. Insulin is very much essential for taking or absorbing the glucose into the cells. If there is a lack of insulin, the glucose will stay back into the blood level. So kidney will be excreting on the glucose level will be increasing in the blood, but the cells will be deprived of glucose, right or not? This is called diabetic. Type 1 diabetes. Type 2, there is a defect in a cell, the glucose will be secreting. When the glucagon means it will be increase the blood glucose level, and insulin means it will decrease the blood glucose level, and somatostatin, it will be the growth hormone releasing inhibiting hormone. Understand? So these are all the hormones is secreted. So our body system is completely maintained by total of the hormone. So this is a small overview, and most of the question being asked. Two more question will come. Define hemostasis, define the hormone, list down the hormone secreted from the anterior pituitary, list down the hormone secreted from the posterior pituitary will be coming. Short notes on thyroid gland, short notes on parathyroid glands, and short notes on renin angiotensin mechanism will be coming, and they will be asking about what is a flight or fright response. You have to write about the epinephrine, norepinephrine, how it is being secreted, what are all the importance of this hormone. Short notes on testosterone, or they will write the function of TSH, FSH, GH, or whatever the hormone they will be asking. So any kind of the questions are coming. This concept, if you understand, you can very well in depth you can learn about the hormones in your book. If you want the notes, I am pinning your notes, pin to you in your WhatsApp group I am doing. So overall you remember this, drawing this, remember about this picture, and keep all the concept in your mind, and then go to the chapter and read in depth about it, so that you will score whatever the mark, nearly how many 15 mark is coming out of all the systems. You will get those 15 mark, 15 out of 15 you can cover from the system, either the anatomy or the physiology. Thank you.